going to perform the monthly rinse on our ProCyte analyzer. So I go into our ProCyte Diagnostics and I'm going to select monthly rinse. It then alerts the ProCyte I'm about to do this procedure. I'm going to change out the little connection here because this is to run blood samples. So we're going to put in the larger one. I'm using this HydroClean solution specifically for the ProCyte. You're going to administer about 2 to 3 mLs of the solution into the tube. Place your tube in the holder, and then we are going to hit start, and it's going to run its monthly rinse. Okay, I'm going to set up this SNAP heartworm test on this patient. You use 4 drops of the conjugate, and 3 drops of the patient's blood. You then invert the sample 4 to 5 times to make sure it's thoroughly mixed and pour it into the well. Once the blood reaches this little circle right here, I'm going to snap it. And you need to wait about 8 to 10 minutes before you can read the results. Okay, and I'm now going to snap the test and set a timer for about 8 minutes. Pull on this facet. Using a fecal probe. I've got a sufficient amount of fecal material. I'm going to come over here to my little fecal cup. We use Fecasol. It's a commercial brand solution used. I'm filling it about halfway full and making sure all the fecal material is off the lid. I'm then going to fill the cup up until a meniscus forms. And then I'm going to place my slide on top of this and allow it to set between 10 to 15 minutes before we read the fecal flotation. Okay, it has now been 10 minutes. We are going to remove our slide, place a cover slip on the slide. Then we're going to come over here to our microscope and place it, doing this one-handed, so it's a little difficult. Okay, it is placed on our microscope. I'm going to flip the light on. There we go. And now it is ready to be read. I'm now going to prepare a fecal flotation sample with the centrifuge. Now, normally we would need 2 grams of fecal matter and a bigger tube, but our centrifuge that we have is only able to use the small 1.3 ml tubes. So I'm going to show it with this, but in a normal situation you would use more fecal material. So first I'm going to prepare the sample in a sample cup with Fecasol. I'm going to make sure I get all of the fecal matter off of the loop. Okay. Then I'm going to strain this emulsion through this gauze sponge into this little tube. It's going to be kind of difficult because we don't have the correct size tube to use. There is a small amount of the fecal solution in here. I'm going to dry it off because some of it did spill because we do not have the correct size tubes here or the correct size centrifuge. I'm going to come over here, place the solution that was strained through that gauze sponge into the centrifuge. And I'm going to up the time to 5 minutes and start. Okay, so our sedimentation, our fecal flotation has been in the centrifuge for 5 minutes. I'm now going to take this top off. Again, we would normally use a larger tube, but the centrifuge we have only uses the micro tubes. I'm going to fill it up with the remainder. I have to hold it until a meniscus forms on the top. Then I'm going to place a cover slip on top of this tube. Let it sit for 10 to 15 minutes. Once it is sat for 10 to 15 minutes, I will remove the cover slip, place it on the slide, and view the sample for parasite eggs under the microscope. Okay. I'm now going to set up a direct smear using this fecal sample that I had gotten on a patient. I'm going to place a little bit of this Fecasol solution on the slide. And then I'm going to get a little bit of the stool sample off using this wooden applicator stick. Okay, and then going to mix it up so it's rather homogeneous in texture. And then I'm going to remove the big clumps of fecal material. Okay, I'm then going to place a cover slip over the mixture. Okay, and then I'm going to place it on this microscope and read the fecal and make sure there's no parasite eggs. Okay, I'm now going to set up a fecal sample for a sedimentation. I've got about 2 grams of fecal material and I'm using some tap water in this cup. I'm going to mix it up real well. Trying to break up all the big clumps of fecal matter. Okay. I'm now going to strain this mixture into this cup here. Now, you can do either a centrifuge and spin it down, or we can let it sit in this cup for 30 minutes, which is what we're going to do because our centrifuge is mainly for blood samples. We don't typically centrifuge fecals. Okay. I'm straining this mixture. Okay. All right. Okay, so our sedimentation has been sitting for 30 minutes. I'm now going to pour off all the top of this sedimentation and just leave a little bit of the sediment at the bottom. Okay, I'm then going to pipette off the top layer of this sediment and place a couple drops on this microscope slide. I'm then going to place a cover slip over this. And we're now going to go place it on the microscope and read it. And you can just follow me right in here. We're going to check for any parasite eggs. Typically this method is used in large animals whose eggs are too heavy to float to the top on a normal flotation. Okay. All right, and I will now begin to examine the slide for any parasite eggs. Okay. Okay, I'm about to run a surgery profile on one of our surgery patients. I just centrifuged the plasma. I'm going to get the sample out and put it in a sample cup with the pipette. I need to select the patient on the machine and select which machines I'm going to be using, and then I'm going to hit run. I'm going to pause this for just a second. Okay, I'm going to load my slides. Here, the light clip and the Chem 10.
I would do it with a brace on for sure.
I'm going to throw away the old plasma from the last sample we used and put in our new plasma sample. And then I'm going to press start on the machine. And it is going to run, and I will show the results when they print. Okay, so our blood work has just printed out on our our printer, sorry. We have a CBC result and also our chemistry result that we ran on our Catalyst analyzer over there using plasma. They are all within normal limits. That's really good for a 9-year-old patient, so she is able to have her surgery done today. Good. Okay, I'm now going to be gathering an ear swab from this patient who has an ear infection so that we can stain it and determine what exactly is the cause of his infection. So I have to take care to make sure that we are very careful with the ears and that we go in at an angle that we do not disrupt or rupture the eardrum. So we're going to go straight down parallel with the head. Okay. We got a lot of goop. I'm now going to roll this Q-tip on a slide, and then I'm going to stain it. Okay. I'm now going to show the proper technique for staining this ear cytology using the Stiff Quick Stain Set. We're going to start with the blue. Either go in 10 times or count 10 seconds. Make sure that you do not touch the sample to the sides to disrupt the slide. I'm now going to give it a little rinse. And I'm now going to dry it with this Bibulous paper. And then the sample will be ready to be read. Okay. So I'm now going to read this ear cytology under the microscope using immersion oil on the 100 times power field scope. And we're going to see exactly what is on this. So, there is tons of yeast. It's probably predominantly 95% yeast, just a couple bacteria. So we are going to let the doctor know what we see and have her confirm that it is a yeast infection and pick some medication according to. I'll do mine separate. We are now about to perform the necropsy on this patient here. There are no external wounds on his body. We are very thin. There's no obvious signs of trauma, so we're going to perform a necropsy to see if there's any indication of diseased organs. Okay.
You can hold the legs out. Okay. Making a midline incision. Don't have to be extra careful to get the exact midline. I'm gonna examine the bowels, although they are kind of discolored because he's been in there for a while and the bowels probably leaked on there. And the spleen. Spleen looks normal. Some of the bowel looks a little odd, but I have a feeling this has to do with the length of time he's been dead. And colon. Looks fine.
I take a biopsy of the liver and the spleen.
Here's the pancreas. And him, we're really interested in the kidneys because on ultrasound, they were only able to find one kidney when he was still alive. Which, there's a kidney on the right side that you can't really see, but appears pretty normal in size. Just vena cava. See that? Mm-hmm. Huge. Mm-hmm. There's his other kidney.
You normal?
Looks relatively normal in size. Granted, I don't do necropsies that often, so I don't really have anything to compare it to recently. Looking for his bladder. Oh gosh, let's see. I'm gonna go off to the side some. I'm putting down the bladder. It's back here. Still full. Okay, so what do you want to biopsy?
The liver and the spleen is pretty fine.
I'll cut him up higher. Do we need thoracic too?
No.
Okay, so his liver. Actually looks pretty healthy. You can see some of the tissue. I can't really pull it out unless I attach it. Gallbladder intact. Stomach. The stomach. It's kind of green because we've had sitting right next to his gallbladder. Cut him a little higher. Get better access to get a biopsy. We're getting into the ribs here. Oh, cut through his diaphragm, but it's okay. You can see the thoracic cavity. Okay, so let's get a biopsy of the. We'll do another kidney too. Just take a sample.
What is this?
Liver.
I'm going to stop it once we get the 6 lap sample and then show and then restart after we break it.
Yeah.
Really make sure he doesn't have anything going on his stomach because he was regurgitating so much.
Gosh, this is gonna walk back here.
I mean, I don't see anything abnormal in the stomach.
I really want to call her.
So you want spleen?
Yeah, that's
Sure.
easy. Okay,
I'm going to cut into his kidney just to see.
I'm going to stop on one second.
Yeah.
Okay, so we have our 2 biopsy samples that we have taken from this necropsy, and we have them labeled accordingly. This is the liver. It's blurry. And this is the spleen. Okay, I'm now going to talk about who can handle a rabies suspect. A veterinarian or a licensed veterinary technician can assist the veterinarian in handling a suspected rabies rabid suspect. All PPE must be taken into consideration and used. Gloves, gowns, hairnets, goggles, masks. It's very important to use all of these when handling that patient. The patient needs to be humanely euthanized, and the head needs to be removed from the body. The head itself needs to be submitted and packaged fresh frozen on dry ice in a hazmat certified container. It must comply with the International Air Transport Association. The rest of the body needs to be bagged in a body bag and double bagged and then incinerated as soon as possible to reduce or eliminate any possible chance of exposure or transmission of the suspected disease. I'm going to clean the vulva in preparation for vaginal cytology. I've got my scrub right here, and as you can see, she is in heat, so I'm just going to clean the outside, get any excess urine or bacteria away. Okay. I'm going to prepare a sterile cotton tip swab for this vaginal cytology. First, I'm going to moisten the swabs with some saline.
Could do that, yeah.
And then the doctor is going to obtain a
Run it
sample.
straight down for a box.
I'm going to restrain the animal, and he's going to go in at a 45-degree angle to obtain our sample.
Because this is open,
Uh-huh.
you'll hole right through that into the stainless on each of these.
I'd have to take those lights down to do that.
Why?
Well,
And now I'm going
our tank
to
is
crack the
covered
slide.
Or drill right through here, is that what you're
Yeah,
talking about?
yeah.
Yeah, okay.
This is hollow, this is just a solid plate.
Yeah.
So it drove through here, through the stainless.
Okay, I'm now going to stain this vaginal smear for the cytology using the Dip Quick stain set. I'm going to rinse and dry it with this bibulous paper. Okay. Now we're going to look at our vaginal smear under the highest power, the 100-time power with immersion oil. Okay, we're going to determine what stage of estrus she is in. So I'm seeing some cornified cells, some with nuclei, some without. There's a lot of bacteria, and a lot of trash also. This dog was still, her vulva was still swollen. There was a little bit of blood, but I'm not seeing a lot of red blood cells on this smear. So based upon what I'm seeing, I'm going to say that she is in diestrus. Okay, I'm now going to describe the 4 stages of estrus and what you would find microscopically. So proestrus, you're going to find a mixture of parabasal, intermediate, and superficial epithelial cells. There's going to be a large number of red blood cells, and neutrophils are commonly observed. Also, there are a large number of bacteria present. Now, in estrus, there's a predominance of superficial cells, and most of those cells are anuclear. Superficial cells are all nearly completely cornified, and virtually no other cells are seen. Sometimes you can see bacteria, but they're often attached to the superficial cells. Neutrophils are absent, and you might see some red blood cells, but typically you will not. Okay, in metaestrus, most of the cornified epithelial cells have been replaced with non-cornified epithelial cells. You may see also quite a bit of debris on the cytology. Neutrophils increase in number in this stage, and erythrocytes are typically absent. Now, anestrus is actually typically before proestrus, but it is a cycle, so it goes around in a circle. So, the vaginal cytology will show predominantly non-cornified squamous epithelial cells, and these cells can be categorized as intermediate, parabasal, or basal epithelial cells.
Go.
I'm now going to perform a skin scraping on this dog. We're going to be looking for demodectic mange or sarcoptic mange. I'm going to start with a drop of mineral oil on this slide here. And I'm going to open this scalpel blade. It's a 10 blade that I'm going to be using to gather my sample. I'm going to dip the blade in the mineral oil to get it moistened. Now, you can shave the area. We're not going to do that at this time. You can shave it using a 40 blade. So basically, you find your lesion, give it a good squeeze to bring any mites that might be under the skin to the top. And then you are going to scrape this area. You want to go perpendicular so that you do not cut the patient. You want to get any crusts or, dry skin or anything, and get a good sample with a lot of good hair and material on it. If there are multiple lesions, you'll want to go in multiple places, and you will want to get, in between the lesions and on the lesions as well. Then we will take all of the sample we got, rub it around here, and make sure it's all off the blade. And now we can go view it under the microscope. So, I need to place my cover slip on top so that we don't get the lens of the microscope all dirty. So you can go back. Okay. We're going to come right over here. You have to video me doing it. Oh, that one didn't work. Right in here. Okay, so I'm going to place this slide on this microscope here. And we are going to see if we can see any sort of mange, mites, demodectic mange. I can't hardly reach. Alright, the sample is in view. And you need to read it left to right box and bottom to top. Seeing a lot of hair and a little bit of red blood cells, but I'm not seeing any mites. No demodectic mange. Those look like little alligators kind of, and the sarcoptic mange looks more like a mite, like an ear mite kind of, but I'm not seeing either. So we're going to go inform the doctor and let them make a definitive diagnosis. Okay. Thank you.
Okay, there you go.
Did it stop? Perfect. Okay, so now I'm going to do our cross-matching procedure, and I'm going to show you that I've already got my blood. I have some blood in the serum separator from the donor, and then also in an EDTA tube from the donor. Then I also have some for the recipient in a serum separator, and another for the recipient in the EDTA tube. I'm now going to centrifuge the clotted samples, and then once I centrifuge those, I'm going to place the serum in plain red top tubes and make sure I mark them accordingly. I'm also going to centrifuge the EDTA tubes at the same time, that way I get them both done. Okay, as you can see, the centrifuge is spinning down our samples, and once that is complete, we will obtain the serum that we need and the plasma that we need for our cross-matching test.